welcome. My name is Dr. Desmond Smith. We're going to be talking about type 2 diabetes during this session. Type 2 diabetes is very common in the United States. The interesting factor is that only about 50% of the people that are type 2 diabetics actually know that they have type 2 diabetes. Overall, it's estimated that 8% of the U.S. population has type 2 diabetes, which is about 20 to 21 million people in the United States. What is the importance of type 2 diabetes? The importance of type 2 diabetes is that it is associated with cardiovascular disease, which includes a higher risk of strokes, a higher risk of heart attacks, a higher risk of renal failure. It also has a higher risk of peripheral arterial disease, and it basically increases your risk of dying at an early age. A very interesting factor is that blood pressure becomes much more significant in patients with type 2 diabetes. In fact, if you're systolic, that's the top number, blood pressure is above 120, you are at a significantly increased risk of having complications from your type 2 diabetes, including renal failure, strokes, and death, as well as heart disease. The equivalence of a systolic blood pressure of 120 in a diabetic person is equivalent to someone who's not diabetic and has a systolic blood pressure of 160. Unfortunately, we don't have any evidence at this point in time that treating patients to a systolic blood pressure of less than 130 offers any additional benefits with medications. However, observational studies have clearly shown that a systolic blood pressure of less than 120 carries a much lower death rate in the diabetic population. So it's not only for us to be treated by a physician for our diabetes, it is also very important that we have our blood pressure treated, and it's important for us to get our blood pressure as low as possible, even without additional treatment. Let me just stop and go back to the classification of type 1 diabetes. A patient with type 1 diabetes are patients that require insulin for their survival. The type 2 diabetic, especially in the early stage, usually does not require insulin therapy for their survival. Their body is still making enough insulin. And in fact, in the early stages, the body actually can be making more insulin to try and compensate for the lack of utilization of sugar by the body. So in the beginning, you have what we call insulin resistance, and not necessarily, your body's not necessarily deprived of insulin production. As time goes on in the type 2 diabetic population, eventually your insulin becomes depleted. In the type 1 diabetic, it's depleted from the very beginning, and you actually require insulin or else you will not be able to survive. Now, when we look at patients on dialysis and patients that have end-stage renal disease, kidney disease, what we realize is that diabetes and hypertension account for 70% of this population. So the majority of patients in the United States that are on dialysis are 1, diabetic, 2, hypertensive, and combined they account for more than 70% of patients that are going to receive dialysis. What's also unfortunate is that majority of these patients are African American as well. So it's very important for us to be aggressive with our management of hypertension in the diabetic population, because we know that high blood pressure and hypertension carries greater prognostic implication than does the sugar itself. We also know that even if we control the sugar, we still have a higher rate of cardiovascular disease in the diabetic population, even with blood sugars that are normal. The microvascular complications like the kidney disease, the problems with your eyes, and peripheral arterial disease is reduced significantly by lowering and controlling your blood sugars. But the cardiovascular or the heart disease part of it is not well controlled with lowered blood sugars. At least we don't have good evidence that controlling the blood sugar will prevent or reduce cardiovascular disease significantly in the diabetic population. It's also important to know that if you're diabetic and you compare yourself to someone who's already had a heart attack, your risk of having a heart attack is similar to the person that's already had a heart attack, even if you've not had one and you're just diabetic. So it's very important for us to look at your heart, to work up your heart, to do stress testing, to do cardiovascular testing, to make sure you don't have any underlying disease when you're diabetic, because sudden death is a major issue with regards to the diabetic population and coronary artery disease. Okay, now let's move on and let's say, well, what can we do? Well, the other things that are important is that we also need to know that cholesterol plays a major role with regards to, of course, coronary artery disease, but it's to an even greater role in the diabetic population. So you have to get your cholesterol under control, your blood pressure under control, and maintain as much as possible normal blood sugar levels so that you won't have the complications that we see often associated with diabetes. Now, these are some of the things that you can do. Okay, number one, if you have a family member, please go to your physician and have them check your 2-hour blood sugar, not your fasting. The fasting is also a good way to check, but the 2-hour blood sugar after you've had something to eat. Or what we do is a glucose tolerance test where we give you a syrup that's loaded with sugar and you drink that, and 2 hours later we check your blood sugar. That's very important. If you have two that are over, where your blood sugars are over 140, then you're diabetic. If you have one that's over 200 at any time, then clearly you are diabetic. Next is we can check your hemoglobin A1C if you're diabetic, and the American ADA, American Diabetic Association, recommends that that blood sugar level, the A1C level, be less than 7 to prevent the complications that we often see with diabetes. As I've mentioned already, your blood pressure is extremely important, and gold treatment, according to JNC7, that's the body that authorizes treatment, is 140 for people without diabetes and 130 or less for patients with diabetes. So it's important to get your blood pressures under control. Cholesterol levels, the LDL level recommended for a diabetic is less than 100 to prevent disease. And of course, peripheral arterial disease, which usually has a significant prognostic implication with regards to the diabetic patient, in that it suggests if you have peripheral arterial disease, not only are you at risk at losing a limb, but you're also at risk for kidney disease and kidney failure, heart attacks, and strokes. So it's important to be checked for peripheral arterial disease. And the way we do that is a test called an ABI or a PVR machine, which we do here in our office. Of course, you have to get your eyes checked if you're diabetic, because diabetes is the #1 cause of blindness in the United States. Getting the appropriate diet, understanding that consumption of sugars, products rich in sugars like fruit drinks, sodas, pies and cakes may not be to your benefits, and also diets that are rich in saturated fats are also of danger to you. Now, if you are already diabetic, you should know that you should maintain a blood sugar range between 60 and 160 all the time. Your fasting blood sugar should be between 60 and 100. And after you eat, it should not be any greater than 140. However, if you're in the older population, we will allow up to 180. If your blood sugars are running over 180 all the time, you need to consult your doctor right away. As an illustration of the importance of diabetes and how quiet a process it is, take Jackie Robinson for a good example. He died at age 53 of a heart attack. He had diabetes and hypertension, and he was also a smoker. So it's quiet. One of the interesting things about human beings is that the things that hurt us, like a broken arm, usually doesn't kill us. God has protected us from pain, so a lot of the processes that are occurring in our vascular system, our blood vessels, where we get blockages and stuff, have absolutely no pain associated with them until the very last moment. So it's important to get yourself checked before you have an event, because once your organs are damaged, some of these organs will not regenerate and you will not be able to recover from the damages that take place. For instance, a bad stroke or a bad heart attack or kidney failure. Thank you.